My name is Ward Blanchard. I'm CEO and founder of the Blanchard Institute and human service professional for nearly 20 years. I think it's really important for clients and families to understand and discuss the concept of the family disease process. It's not lost on anybody that this disease is a family disease, but what does that mean? There are words like codependency and enabling and family disease, just blanket terms that are thrown out that never properly explained. And often there's traditional language that's used that's very shaming when they call families codependent or enablers. And that's just a travesty, because the truth of the matter is what each side, what the identified patient survives and what the family survives is traumatic. Living and surviving a mental health issue, living and surviving a substance use disorder is traumatic. Being in a relationship, being a family member, being involved in a loving relationship with somebody struggling with this progressive disease is traumatic. It is, you guys are survivors and are resilient and shouldn't be shamed, shouldn't be called enablers or codependent, because the truth of the matter is that trauma, as a result of experiencing that, families and patients develop PTSD symptoms. Too often families are shamed for their behaviors of being codependent, when in fact it's the trauma. It is the trauma bond that happens. And that's a very human response to a very traumatic situation. I would actually be concerned if a family had a mental health issue or had a substance abuse and family members weren't impacted. The fact that you have and experience this trauma actually goes to communicate how close and connected and loving the relationship is, because you're impacted so severely. That is the trauma bond that families enter this process with. They're trauma bonded onto the patient. And the anecdote that I provide and communicate is it's similar to the disease being a silverback gorilla. Family members come in here directly tied to the gorilla. That means that their life is consisted, drug around day in and day out, minute to minute, however and wherever the gorilla goes. That's the very definition of prison. And so the family disease process mirrors that, being tied directly to the gorilla. The family recovery process isn't cutting the gorilla out of your life, isn't eliminating the gorilla. We don't expect you not to be impacted. We don't expect you to put down the boundaries and not to be affected. That would be inhumane. You're always going to be in a relationship with this person, and we do expect there to be emotional impact. So we don't expect you to cut the person out of your life, but we do expect you to cut the rope. And that doesn't mean that you're not going to be sit back and be scared of the gorilla, or sit back and be impacted or have an emotional roller coaster. But it does mean that you're not going to be drug around by it day in and day out. Because family recovery is about family and loved ones developing the skill set to understand that their loved one's behavior is outside of their control. We're all surrounded by people that don't behave as we think they should, that we have zero control over. And so the family recovery process is developing the skill set, the boundaries to live a long-term, happy, healthy life, regardless if your loved one gets sober or not, because that's completely outside your control. So it's about cutting the rope.